what ingredient can help COVID patients. Obviously, I can name one very specific example of one very specific active ingredient of Elixir Placenta, and that is olive leaves, no, ole, or olive leaves extract, no. Olive leaves extract has oleuropein, no. It has hydroxytyrosol, and it has muscarinic acid, no. And napakaganda po nito because it has antiviral, specifically anti-SARS-CoV-2. It has anti-thrombotic activity. You know, I mentioned earlier, thrombus ay yung clots, thrombus clots yun, no? May ganitong function ang ole, no? And of course, anti-inflammatory, no? Nagmaga na yung mga tubo ng baga natin, inflamed na, and then hindi na makadaan. Pag nagmaga, hindi na makadaan ng hangin or blood, no? Doon sa mga kidneys natin magana. So it has anti-inflammatory activity. How nice, di ba? Kompleto siya. Now, let's go into specifics. There have been experiments, no, proven that this particular active elements that you find in olive extract has the following properties, no? It has hydroxytyrosol, no, which is virucidal, no. Pinapatay ang virus, especially against the COVID-2, no, through the structural changes, which changes, it disrupts the viral genome, no. Viral activities din, no, itong olive leaf is shown when it decreases luteolin, which is also against the SARS-CoV virus, and of course inhibition of the COVID virus multiplication. No? Ito pa, I'm going into more details. They made a spray of hydroxytyrosol, and it has proven against COVID, no, infection. 50 volunteers in their experiment, it showed decrease in viral load, no, and cure in 6 patients within 10 days. Okay, this is research that was done in 2020, no, and it has ethanolic extract. Again, the olive leaves extract exhibited anti-inflammatory activities, no, properties, and it has analgesic or it addresses pain, analgesia, no, and the level of which is similar to indomethacin, which we use to treat even mga pains, no, muscle pains, bone joint pains. It has antipyretic, anti-inflammatory. Ito na naman, no, which I have been saying earlier. It helps, especially dito sa ating cytokine storm, no. We need anti-inflammatories and anti-thrombocytics. Now, oleuropein, okay? Oleuropein has been known, okay, to have antiviral properties, no, anti-inflammatory as well properties, and it is virucidal. And this particular, well, it has been proven, it has experiments, as I mentioned earlier, may mga studies to show that, no? Hydroxytyrosol, again, it destroys pro-inflammatory markers. So, it promotes anti-inflammatory properties, no? Which we need when we have COVID infection, no? Then, ito po yung basic na 4 na mga elements that we find. Terpenoids. Terpenoids we find as one basic element of olive leaf extract. And under terpenoids, you have oleanolic acid, you have ursolic acid, muscarinic, I mentioned earlier, and oval. All of them are anti-allergic and anti-inflammatories, no? Makakatulong when you have especially severe, moderate to severe COVID, no? And as well as may mucolytic activity siya, no? Now, going to immunomodulatory, no, effect activities of the olive leaf, no, This is manifested by hydroxytyrosol and muscarinic acid. No, it inhibits, once you have this, it has been shown to inhibit the cytokine storm, which overwhelms our immune system. Pagka nagka-cytokine storm ka na, magdasal na ang pasyente because kung malakas ang immune system mo, you could get over it. Pero kapag mahina and you have a comorbidity, diabetes, hypertension, and other problems, you may die because of this, no? And it is a good treatment for cough and asthma because it is a mucolytic, no? It lyses the mucus na nakadikit doon sa ating mga pulmonary bronchus, no? Sa ating baga, no? Let me mention that the anti-thrombotic activity of muscarinic acid also, okay, ito na tayo, sorry. Anti-thrombotic activity of ethanolic, hydroxytyrosol, and muscarinic acid is also recognized as indeed a very good property of this particular active ingredient of Elixir Placenta that helps decrease platelet aggregation. Ano yung platelet aggregation? Nagdidikit-dikit yung platelet. So, it forms clots, nagbubuo-buo. It decreases it, no? Nawawala yun, no? Nalulusaw, no? So, it prolongs prothrombin time, no? It prevents associated intravascular coagulation. Napiprevent niya yung pag-coagulate, yung pag-clot ng dugo. So, ang laking bagay po nito, no? So, moving on, now we say that after all what I have mentioned, napakaganda ng ole, no? Olive leaf extract. It is very rich in secondary metabolites, which are antiviral. It has anti-inflammatory, anti-fever, pain, immunomodulatory. It modulates our immune system. Yan ho pang ibig sabihin. Yan. Anti-thrombotic, anti-clots, no? Mga clotting, ha? Kinalabanan yan. And then it has a potential to control cytokine storm. Nako, napakaganda. And which is seen in moderate to severe COVID, no? So, and other complications. Also, ang ole or olive leaf extract has antiviral activity that has been described to benefit, no? It benefits which includes its biosafety, its availability, low cost, no? Kung ano-ano mga mahal na mga remdesivir ang mamahal po nun, o tocilizumab, which is what, 6,000 per, ito ang mura. So it leaves this natural remedy to be given a chance, to give it more experiments to develop this into a more potent anti-COVID treatment, no? Hindi lang isinasama sa mga supplements, but kailangan buo talaga as pure, no, form. So, yun lang ba ang makikita natin sa Elixir Placenta? Of course not, no? Our main actor dito, of course, sinasabi natin, co-starring itong ole, no? Olive leaf extract. But the main actor here is, of course, what is our main ingredient in Elixir Placenta? Of course, obviously, it's the deer placenta, which contains, obviously, stem cells. And how does stem cells combat coronavirus? There have been experiments to show that, for example, this particular research showed that a 65-year-old woman was given, nasa ICU na siya, was given stem cells, and on the third day, the patient started to improve, and the same treatment protocol was given to 7 patients, and all of them improved, recovered from COVID, no? Courtesy of the stem cell that was given to them, no? Nawala yung kanilang fever, nawala ang shortness of kanilang paghihinga, nahirapan sila huminga, and decreased oxygen saturation, wala din yon. Of course, pneumonia. And all of this decrease in the next 2 to 4 days, no? Ito, nakita ito. And even the lung findings were shown by CAT scanning, no? Makikita doon that the degree of pneumonia had diminished tremendously because of stem cells, no? Now, ang stem cells, how do they act, no? They in COVID, they are powerful immunomodulatory and ito yon, anti-inflammatory. Pabalik-balik tayo, anti-inflammatory property of stem cells. The anti-inflammatory effect of stem cells has long been recognized. That's the reason why for the past years, stem cells have been used to treat rheumatoid arthritis, ulcerative colitis. Approved na ito ng FDA, no? All over the world. Multiple sclerosis, kung tawagin MS, no? And others who have transplanted organs, yung mga kidney transplant and other organs, ginagamit na po ito, no? So, basically, this is what happens, no, in an illustration you can see here pagka nagka-COVID, no, and pag ito yung kanyang status, makikita ninyo when given stem cells. The stem cells has the effect of immunomodulation, as I mentioned earlier. Maliban doon, it is antimicrobial. So ang napaka-importanting effect ng stem cells for COVID is ang virus goes to the lungs. I mentioned you earlier, no? Kinakain niya, no? Sinisira yung tissue ng lungs. So damage na po 'yon. Hindi na madadaanan ng hangin 'yon, no? So hindi na madadaanan ng hangin, there develops fibrosis. Fibrosis, fibers 'yon. Fibers, ano ibig sabihin ng fibers? Parang scar, no? Peklat. Kaya nga pagka in-x-ray tayo, sasabihin mahina ang baga nyo, ay matagal na ito dahil mayroon na pong peklat ang baga nyo. This is it, no? Magkakaroon ko ng scarring or fibrosis. Stem cells will bubuhayin niya nung scars na yan, no? It has, as you can see here, anti-scarring effects to avoid fibrosis in the lungs. Babalik siya, magiging healthy ulit, no? It reverses it. So napakaganda ho ng stem cells that can be used, no? So ito siya, no? When COVID goes in, ito, okay, obviously the stem cells has the following functions. It has antiviral, okay, property. It repairs cells, no, cellular repair, and then also tissue regeneration. Lahat ng organs na nasira ng virus, ng clots, no, will be repaired by stem cells, no, and immunomodulation, no. Ito yung sinasabi ko, iniiba yung iyong ini-improve or tawag nito, binuboost ang ating immune system, no. Okay. Specifically, it is very good for itong mga diseases which of course refers to the lungs, chronic obstructive pulmonary disease, okay, yung acute respiratory distress syndrome and the like, no. Basically, in summary, dito natin makikita that stem cells, which Elixir Placenta is most, sabihin na natin, kilala siya doon, has these properties, no? Since the COVID virus has destroyed the alveolus, no, alveolar capillary membrane, nagkaroon ng lung fibrosis, tumigas na, no, nagkaroon ng scarring, nagkaroon ng inflammation, okay? Ang stem cells will repair, regenerate, babalik ulit, no? It is anti-inflammation. So, yung maga, pag nagmaga ang ating mga tubo, mawawala yun. So, makakadaan ulit ang ugat and anti-fibrosis. Ganda, no? It addresses almost all the basic problems. So basically, stem cells treat the lung injury. It repair that is caused by the virus. Multipotent differentiation. Ibig sabihin na multipotent, maraming areas na i-repair niya. The heart tissue na sinira, cardiac muscles, aayusin niya. Kidney muscles, aayusin niya. Multipotent, potential na maraming potential, no? Na it can develop lungs, ayusin niya. It produces a variety of cytokines and growth factors, no? It it differentiates. It differentiates means ang ibig sabihin niya tutubo siya ng ganon, no? Tutubo siya ng alveoli, epithelial cells kasi nasira 'yon, no? Ng lung cells, no? Ng endothelial cells sa mga sa mga ugat natin, no? Blood vessels, no? So lahat 'yan, it promotes injury repair ang bottom line, no? Repair to damaged tissues na hindi nagagawa yan ng kahit anong gamot. Only stem cells do that, no? Repairs of injury that has been suffered by our organs. It promotes angiogenesis. Ano bang angiogenesis? Mga blood vessels yan na nasira, no? Angiogenesis refers to recovery or regeneration, bumabalik yung mga ugat natin, and promotes repair of the kidneys and intestines. Ayon nyo ba noon? Napakaganda, no? It addresses all of this, no? That has been caused by COVID, no? Ay, nako. Ang dami na, no? So, we're almost at the end. So, basically, yun na yun. Now, but wait, there's more. To surprise you, actually, just look at the list of the active ingredients of Elixir Placenta. You will see a lot of this. The other active ingredients of Elixir Placenta. Look at that, no? Basically, I can name immediately right there. You have rhodiola, which stimulates our immune system. Pinalalakas niya, no? To recovery and to counter a COVID virus. Grapeseed extract, which reduces blood clotting, you know, and anti-inflammatory properties. MCT, medium chain triglycerides, has anti-inflammatory action, no? Properties. Ay, nako, paborito ni Gerson, red ginseng, no? Anti-inflammatory effects. Esqualene, it's an immune system booster, no? Pampalakas para hindi na mag-proceed tayo from mild, para na hindi maging moderate to severe, no? Ang sea buckthorn oil, no? It supports wound healing, 'di ba? Sabi ko, nasira, na damage yung ating lungs, kidneys. It reduces scarring, no? Ano mag-scar, fibrosis, yung ating mga baga, no? Nawawala yan, nababawasan. Immune system booster, anti-inflammatory, it fights infection. And the last one, black cumin seed oil, it improves lung function, di ba? Especially COPD, no? Chronic obstructive pulmonary disease. Nako, napakarami. Isa pa lang ito, COVID pa lang po ito. So, ladies and gentlemen, no, ating mga GFAX believers, I hope you learned a lot from this afternoon's session, a lot about secrets and mga benefits, properties of Elixir Placenta na